It's rare that landmark history unfolds on such a global scale, but 2020 will be remembered for the impact of the COVID-19 pandemic in every corner of the globe. It will also be remembered as a time when the best minds in the world worked together to problem solve faster than ever before, and for innovative projects which would have lasting effects on epidemiology, medicine and beyond. Here are some of the most influential. With social distancing, travel bans and limited gatherings crippling economies worldwide, the usual methods of vaccine development needed rethinking to fast-track the process. Developing new vaccines usually takes years, but Oxford University had a head start with COVID-19. They'd already developed and successfully trialled a vaccine for MERS, a respiratory infection caused by a similar coronavirus. On the 30th of April 2020, Oxford University announced a partnership with AstraZeneca. This multinational pharmaceutical company had the capacity to develop and manufacture vast quantities of a vaccine needed globally. Collaborating would give it the best chance of success, but time was critical. Combining phase 1 and 2 trials speeded up the process while maintaining safety standards. AstraZeneca also started manufacturing before clinical approval, a risky step should the vaccine fail in trials. Additionally, there was a no-profit agreement for the vaccine during the pandemic, so as many people as possible could benefit. The combined efforts of Oxford University and AstraZeneca could literally reopen our world. If trial results are positive, normality may resume once more. As the novel coronavirus spread through Europe in March 2020, health services everywhere were feeling the strain. In the UK, intensive care units were becoming overrun. With many of London's hospitals already at capacity, a plan was devised to rapidly increase bed space across the capital. The NHS Nightingale Hospital opened with 500 beds on the 3rd of April 2020, with space to scale up to 4,000 beds as needed. Its 80 wards covered an area equivalent to 12 football pitches. Incredibly, this temporary hospital was constructed in just 9 days in a donated space from the XL Exhibition Hall. Using wartime principles, the government drafted the British Army to assist. Emergency teams in Australia and Canada were among those who reached out, keen to learn from this rapidly deployed solution to a problem faced globally. With no vaccine yet available for COVID-19, many other treatments were explored, including using antibodies from recovered patients to help others fight the disease. In the USA, the National COVID-19 Convalescent Plasma Project began as an academic paper, quickly developing into a potential treatment.
My name's Nigel Paneth, and I work for Michigan State University.
The treatment involves extracting antibody-rich blood plasma from convalescent patients and administering it to those with active infections to try to help their immune systems fight back.
Short-term protection lasts until the antibodies disappear. You're not making them yourself, you're not replenishing them. So it gives you a few weeks, but it's very, very useful in the early stages of disease. We had suddenly a lot of people wanted to talk to us. We had a big conference call with a lot of people. I suggested we organize into groupings, communications. I mentioned communications. Next thing I know, I'm being asked to develop a website. 2 big companies started to get involved with us, Amazon and a company called MITRE, M-I-T-R-E. And Amazon Web Services somehow became willing to assist us to put up a website. And the concept was we would inform the world about what was going on with COVID, what are the studies, trying to encourage studies. You know, we came not as advocates, but as investigators. We also set up a donor site so that donors could identify themselves and we could link them to blood banks and providers. And we went through all sorts of evolutions of that. And eventually we set up a map to identify physicians who had been giving plasma from the website so that people could even find people who are doing that in their community.
Innovative projects of every size have helped tackle the COVID-19 crisis, potentially saving countless lives. With them, they brought creativity, unique solutions, and a new way of thinking about how we develop medicines, treat infectious disease, and collaborate to achieve our goals.